Hi, everyone, and welcome to another live webinar. We are going to be talking about two really interesting topics today. We're going to be talking about public health nursing and pharmaceuticals. So I have a really special guest with me today. We go way back. We actually went to nursing school together. And so without further ado, I'd love to introduce Marlene and have her share a little bit about herself.
Oh, hi. Yes, it's Marlene, and thank you, Sara, for having me. Sara and I haven't really seen each other for a long time, so this is great. I am a nurse. I graduated the same year Sara did in 2007. I think that's right. And most recently, I am the associate director for vaccines policy for Ontario, and I work for industry for Merck Canada. And prior to that, I spent 15 years working in the public health sector. And I did a variety of things in public health, from frontline public health nursing, healthy babies, breastfeeding, to vaccines, infectious disease, and infection prevention and control. So that's a little brief blurb of my resume.
Yeah, super exciting and very impressive. So anyone watching live, if you want to just put some comments into the chat, I'd love to know where you are watching from. So put that into the chat. And also, as we're going along, if you have any questions at all, also put them into the chat. We'd love to get some live questions. Otherwise we're happy just to chat to ourselves, Marlene and I. And so we just want this to be interactive. So let's get some comments in, and I'd love to know where people are watching from. A little bit about myself, if you don't know, my name is Sara Fung. I am a registered nurse for 17 years now, and I worked 8 years at the bedside doing a variety of different roles, from inpatient care to clinics to research. I did a bit of education, continuing education, nursing leadership, you name it. And so about 5 years ago, I started helping other nurses with their careers. And I think this is a piece that's really been missing. And Marlene, maybe you can chime in here. If we ever learned about resumes, job searching, job interviewing, anything like that in nursing school.
Yeah, no. It was an interesting thing coming out of nursing school, because I, like probably some of the rest of you listening, didn't have a huge interest in bedside nursing after going through clinical. I knew that it wasn't exactly where I like to be. And I started my nursing career a little bit later. I had done some like child and youth type work a few years prior to actually going into nursing. And so I had this kind of social work mindset. And when I found public health during my rotations in my, I think it was my fourth year, that I did a public health placement, and I was like, this is for me, right? Like I love public health. I like what they do. I like the preventative medicine side of nursing. And so there's a lot of pressure to really kind of go one way, not too much preparation for looking at non-traditional ways of having a nursing career.
Yeah, and I think that's very typical. So there was nothing, unusual about not getting this information, but I think that not having this in nursing school and then not learning it on the job, it just made me feel like something was missing. And I think a lot of nurses that are looking for something non-traditional may be at a disadvantage because, like you and I, as women, as working parents, as nurses, we're not taught how to market ourselves. We're just you work hard and people will see, but people won't see, especially if you're looking to move to a different organization, or as in your case, you're moving to industry, as in the private sector. You really have to sell yourself, and the competition is stiff. So you really have to know that it's okay to talk about your accomplishments. It's not bragging if they're asking. I had a client ask me recently, like, is it okay if I talk about my accomplishments? I feel like I'm bragging. And I'm like, that's literally what they want you to do. It is a job interview. So just getting comfortable with that, I think, is really important. I see in the comments here, we've got someone here from Toronto. We've got Shantae from Mississauga, and we've got Stanley from Markham. Awesome. And so just to back up a little, maybe you could talk, Marlene, about how you made the decision to go into public health. I know it was a rotation that you had. Was this rotation something you chose, or something that just sort of was handed to you?
Sara, I don't remember. I really don't remember. I would feel like I probably asked for it in the sense of, not loving some of my placements, just being like, I don't think like this is interesting. I like the patients, I like aspects of it, but I don't necessarily want to do med surge. I don't know if any of us like absolutely loved med surge. There's probably some of us out there who did, but um what made me decide to go into public health, honestly, was more about people and mentorship. I had the most amazing placement in public health where I was given like some really great mentors, some autonomy, the ability to make decisions, to see how a team function. It was probably it was like a really great functioning team that I worked on. They had a lot of fun together. So it was a healthy work environment, really probably pulled me more in that direction, along with the fact that it aligned with what I wanted to do at the time.
And what would you say are some skills for nurses that, let's say they are at the bedside right now, they're trying to break into public health. Do you think there are some skills that are really useful to have?
Critical thinking skills probably being top of mind, the ability to actually um, probably more now than ever in any job that I've had or looked for is the ability to use evidence-based decision making. I do think that's one thing that is extremely important in the public health realm and in my current job is to not ever um, kind of take somebody's word for something. And I had a great nurse that I worked with in public health when I started there, and she was had come from the ER, and actually she taught me that. She'd be like, "Well, this is the answer to this, but don't take my word for it. Look it up. Make sure you know where to find it." And to this day, I practice that way. Is that when I document something or when I give somebody advice, I always reference. I'll tell somebody where it comes from because it doesn't come from my own head or my own knowledge, but having the ability to actually use critical thinking, make sure you're using evidence-based practice. Networking skills was another big one for public health because nothing is done alone in public health. You need the community, or shouldn't be done alone. So the ability to network, and I don't like the word network per se so much as I like connection, building
Mhm.
connections. So that's something, your people skills, important. Again, not something I don't know that we talked about so much in nursing school. I know we had like the nurse client relationship piece, but the ability to actually connect with other um, professionals or organizations or agencies, very important too.
Mhm.
Problem solving.
Yeah, in my resume writing brain, I'm thinking like interdisciplinary collaboration or maybe
Yeah.
stakeholder engagement would be some fun ways to say what you're describing.
Yeah. I love
Yeah,
it. Yeah.
yeah. And so we've got some more visitors. We've got Harjot from Ottawa, Nicole from Ottawa, Nancy from Manning, Alberta, and Heather from Ohio, and we've got someone from Maryland. So yeah, this is great. Now, I know this is a really difficult question to answer, but a lot of people want to know what a typical day is like. Is there a typical day in public health, or could you describe just some skills that you might be using on a daily basis as a public health nurse?
Well, there was a different typical day as a frontline public health nurse versus managing programs. Probably quite different from the admin side to like the clinical side. Um, I don't know. Is there a typical day in acute care nursing? Because I'm thinking like from a public health perspective, it was a lot of in office work, right? So it's like you were there, you were at either your desk or in clinic,
Hmm.
um, from your like 8:30 to 4:30 or 9 to 5. Um, and as a frontline public health nurse, it's fairly typical because you know your clientele, you know your mandate, you know what you're doing, you book people in. Um, in management, probably not a typical day. When you work infectious disease, you always had that meningitis case come in at 4:30 on a Friday afternoon, which meant you suddenly worked a weekend that you weren't expecting. Um, I don't
So
know.
I guess just to clarify, what are the different settings then that public health nurses work? Are you like you could be going to someone's home, right? Like you could be doing a home visit, you could be working in a clinic, you could
Sure.
be doing office work. Like there's a variety of roles that you can have too, right?
Yeah, so quite broad. And I can maybe speak to the different roles I had within public health. So I started out in Healthy Babies, Healthy Children, which was doing at that time, the program's changed a lot in the past number of years, but at that time was driving around all over the especially rural countryside, visiting new moms who came home from the hospital, and then also liaising with the hospital and seeing moms in hospital before discharge. So that was a really fun job. It was great. And then I ended up doing breastfeeding too at that point in time. So they were running breastfeeding clinics through public health. Again, I don't think many health units continue to do that, but that was part of what was available at that time. And then teaching prenatal classes, running, kind of postpartum support groups for new parents. And there was also the infectious disease program, which did all of the disease follow-up, case management, outbreak management. And now most health units have IPAC teams, infection prevention and control, where they work very closely with their hospitals and congregate living settings where you're offering support, advice, education, managing facility-related outbreaks. Infectious disease was a really fun job because it was more like detective work. You had to figure out, where the source of the outbreaks were. I worked a tuberculosis program where we did a lot of TB follow-up, which again was a lot of home visiting and community visits. Let me think. They have dental programs, so there might be some more. That's probably more of a nursing management thing that looks at the dental programs, health promotion programs, where there's nursing roles. I feel like I'm missing a big one if there's anyone listening from public health, but, and of course, vaccine preventable disease, which was probably one of my favorite, where you did the school-based immunization programs as well as clinical services, and then sexual health programming, where you're actually doing sexual health clinics and STI screening, counseling, a lot of health teaching. So there's a lot of very interesting and quite different jobs that you can have within public health. I'd say I moved around through a number of them before settling into management roles where you tend to stay for a little longer.
Yeah, that's interesting. I tell people a lot. I actually had a job offer at a public health unit, and it was for healthy sexuality. And I always regretted turning it down. I turned it down because it was a 1-year contract. And then I found out later, a lot of nurses had told me later, oh, everyone gets in on a contract. And it's really easy to get full-time afterwards. And nobody told me this. So if anyone is watching, my experience is that you often get in on a contract and you do end up finding a permanent role afterwards. So is that the case where you were, or is it different?
No, I was saying 100%. That is what I've told everyone that ever asked me that question too, is, and that actually goes for any job I've ever had that other people thought was great, is that you don't get those jobs necessarily. Some people get really lucky and they might get that job right off the hop, but most people, it requires that skill that I talked about earlier, which is the ability to connect, the ability to build good connections and relationships, because oftentimes you'll end up maybe taking that contract or that part-time job or something. You do take a chance because the organization is taking a chance on you, and then you have a chance to really showcase your skill set and shine, and then make an effort to get to know the people. And I guess, like you mentioned earlier, is like, it's not bragging if they're asking, but it's like actually taking the time to reach out to the person running the program that you'd really like to be a part of and saying, hi, like, I'd really like to, this is my dream job, I think. And like, I'd like to be on your team. Those things go a long way.
Yeah, it's one of the regrets I really had in life, and who knows where I'd be if I'd taken that 1-year contract, but I digress. If I can help someone understand, and you've said as well, take a chance on the contract. I know that there are reasons to do that and not do that. A lot of it might be related to pension or benefits, which I understand. But if you're in a position to take a contract, I think it's worth taking a risk to get the job that you want. So now you made this jump from public health into pharmaceuticals. Can you talk a little bit about what that journey was like, or what prompted your decision to jump ship, essentially?
Yeah. Yeah. There's a number of factors. So like I said, I spent about 15 years in public health, and I didn't mention that actually during my public health career, I also worked part-time as a nurse, I would say a nurse consultant, but it really was, the title was nurse assessor for Veterans Affairs Canada. So I worked in a I loved that job. It was like my ability to keep up my physical assessment skills and also like understand the broader healthcare system and how it was impacting. And then during my public health career, um, I think just having been there so long and trying to run programs and like struggling with understanding how the public healthcare system works in Ontario and a lot of how it doesn't work, like maybe understanding the dysfunction over time. I took a few courses in like quality improvements and I did my lean green belt, I think it was, and love it. Like I was just like, okay, this is like, we need to fix things. And maybe that's like every nurse's downfall. It's like you just want to make things better. You realize you really get an opportunity to see where the system is failing society. And so in my public health role, we struggled so much to get vaccine rates up. So vaccines, I'm very passionate about vaccines because I see they're like a lot of our future kind of depends on the ability to have vaccines, especially when you look at antibiotic resistance and multiple other issues. And it's just one of the key pieces of preventative health. And so I love them, but I was like, here we are. We have this amazing portfolio of publicly funded vaccines in Ontario, but we just can't seem to get them in arms. Our rates are dismal. I mean, to this date, we don't even know what adult immunizations are like in Canada. We rely on an actual survey
Wow.
because we don't have data. Every 4 years, they do a national survey and ask adults what their immunizations are and if they were immunized for the things they should be immunized for. It's
Oh,
absolutely bizarre. We don't
yeah.
have
You think there'd be a record somewhere, right? Like there's so much record keeping that goes on.
in Ontario, we only have legislation that allows us to collect vaccine records from age 0 to 18. And aside from that, it depends on your either your paper yellow card or digital card, which no half the population doesn't have them. And the other half might have them, but they might not be up to date. And you get
Right.
vaccines in different places. So anyway, I'm getting off topic, but that is all part of why I ended up where I ended up. So I worked through I was in managing infectious diseases during the pandemic, which rolled into COVID and managing COVID. So shortly after, at the tail end of COVID response for public health, this opportunity came up in industry they had a new role that they were trying to start. And the reason they were opening this role, it wasn't the role I actually have now, but they wanted to understand why the publicly funded vaccines just fell off the map during COVID, that nobody had, the vaccine rates were awful. And they were like, we don't understand what this is. We need to hire people who know and help figure it out. And during my course at public health, I actually worked in a public health unit that not all public health units in Ontario are like this, but this one was like very open to understanding the role that vaccine manufacturers have to play in the healthcare environment. They weren't seen as big bad pharma like it's looked at in some cases, but really as part of that ecosystem. We need manufacturing. And so I had some exposure to working with people from industry, to understanding what they do, what common goals were, and how they were helping reach the same targets that we had. So I had some connections. I knew some people. So I had some people reach out to me and say, hey, is something you'd be interested in doing? And at that point in time, I guess if I roll into the personal, I had 2 kids who were really struggling in school or out of school, truthfully, because of COVID, that I was trying to navigate. I mean, my 10-year-old was cooking the family meals, and I had a kid in grade 3 who couldn't read because she just never went to school for those COVID years, because honestly, she watched TV because I was working
Right.
all the time. And I'm like, I need a life switch. I need a reset. And I knew things would never go back to be the same as they were before. And I was like, I think I can do more for the vaccine landscape from a different side than I can trying to pick up the pieces from within public health. So it seemed like I was like, I think it's time to take a chance. And I did end up accepting the opportunity. I stayed in that role for a year. soon discovered that where I really wanted to be and where I could impact the most change was in the policy side of things, the health policy. I had a lot more ability to create the change that I really wanted to see, and so I moved into that. I had the opportunity to move into the policy role, which I did, and not regretful. Like, I really wish that I had known the things that I've learned to know on a, national, global scale, would have helped me a lot in running my programs at public health. But you don't know what you don't know.
Right. Well, I think it was really brave of you to take this chance. It sounds like you don't regret it and you wish you'd done it sooner, if anything. And I think this is where a lot of nurses struggle because, like, this is what I remember from when I graduated. So a lot of people were telling me to go into med surge, which for me actually made no sense because my final placement was in labor and delivery. So to go from a specialized area, which I actually quite was enjoying, to do med surge because it's what I should do to develop certain skills that I wasn't quite sure I needed. And then to think, like, this is it. This is your nursing career. You're going to do med surge. You're going to work here at the hospital and then retire. And I just felt like there had to be more than that. And I think a lot of nurses they're afraid to leave seniority, number one. They're afraid to leave where they are on the pay scale. Maybe they're afraid of losing benefits and or pension, but you were willing to take that chance. And I think that, a lot of nurses should really think about, yes, you might be leaving something, but what are you gaining by going somewhere else, developing new skills? And I'm sure there are benefits to working in the private sector that, not everybody knows about. So I think that's a really great thing that you did. And I see that there are some questions in the chat, but was there anything else you wanted to share about that transition or any advice you have? Like, I know you mentioned actually networking. So that was something that stuck with me, that you had networked and you had some connections to where you ended up working. So I think one takeaway that I have from this is always be networking. And I think this is something that we should always be doing, and not necessarily for any specific goal really, but just for opening up opportunities for yourself. Sorry, I'm blabbering on, but was there any other advice you wanted to share for someone who's looking to make that move?
Yeah, I do have one, and I think this was advice that somebody shared with me, and I took it to heart, and it's been so valuable. But really, is to understand personally where and how you add value. So if you don't understand your own, what you bring to the table, and basically it's kind of like personal branding, I think, is to like understand what are your skill sets as a nurse, what have you learned. And I'm not talking like I can put in an IV like really well, like, or like I'm really good at injections. It's like, but what are the underlying things that allow you to be really good at the skills?
Mm-hmm.
What are those basic things on a day-to-day that make you a successful person and a successful nurse, and actually learn how to like talk about them? Because I think you mentioned earlier that like you have to be able to I don't know, brag about yourself or speak about
Sure,
my watch is talking and saying that she doesn't understand. Yeah, I think you just need to be confident about what it is that you do really well and what you can offer a company or an organization, and be able to speak to it. And it can't just be like kind of around those basic skill sets, like, oh, I know how to provide breastfeeding counseling, or I have this course. It's like it's more than that. It's really looking at how you can add value to the organization and where you want to go and how you want to grow, and being able to put it into words.
Mm-hmm. And I think it's like what we call having like the unique value that you bring. So you mentioned that you had worked in social work settings before becoming a nurse. I think that's part of your unique value. It's not something that is like, oh, that's something I shouldn't mention because it doesn't make sense. It's like, no, this is how it makes you who you are. And anyone that's going into nursing as a secondary and even a third career, there's a lot of value that you can bring. I've had clients that worked in real estate before becoming a nurse, and they're like, well, what value does that bring? And I said, well, customer service for one, conflict resolution, understanding how psychology works and that kind of thing. So it's just about how you market yourself. There is a question actually in the chat for you. Where did it go? So someone is coming from, Here, I noticed that you have your Master's of Public Health. What agency would you recommend someone doing their placement in? Does that question make sense?
Yeah. Yeah,
Okay.
it makes sense to me. Um, well, it depends on what you want to do. So you could get super adventurous, I guess, and do your placement in an organization that you're like, I would never dream of necessarily doing this as a career, but I might learn something. Like for me, I'm like, I think I feel more adventurous than I did 3 years ago. So maybe that's something I would do now that I probably wouldn't have done. Like when I did my placement, my MPH placement, I actually did it in public health, which is a little bit sad. I wish that I had branched out actually and done it in something I was unfamiliar with. So that would probably be my advice, is to say, don't stick with what you know. Go try something new.
Mm-hmm.
A good thing, it's a good way to know what different companies or organizations are looking for with your skill set too. Like when you go into something new, like a placement, is to say what type of skill sets, why are they hiring an MPH student to begin with? And what type of skill sets are they looking for? And is that something I have? Kind of to build your portfolio of skills.
Mm-hmm. Yeah, that makes sense. Yeah, it sounds like a lot of times we go with the safer option because it's what we know. But this is actually your one chance to try anything. And why not experiment? Because you could always go back to public health. You already know it. It's your fallback. But trying something new, I think, would be a great thing to do in this day and age. It's really, again, about making those connections and taking whatever opportunities come your way. So we've got Lynn. I know Lynn. Hi, Lynn. So Lynn is a public health nurse with the Healthy Babies, Healthy Children in Durham. Glad we have some public health nurses. Nicole wants to know, wondering how useful is taking courses in project design, project management, and project evaluation for your current role?
I wish I had my PMP for my current role.
I wish I had mine too. I just to interject, I chickened out and I got my CAPM, which is a certified associate in project management, and I should have just done the full PMP.
Yes. Yeah, I truly, like, at one point I keep saying that maybe I'll go do it because I am a little bit disorganized, and I do a lot of project management. That is the majority of my role now, is really managing all kinds of projects, some where I'm like leading them and some where I'm involved in them. But you have a role, and I think I would be a lot better at my job if I actually had some formal training instead of the trial by fire, because I've learned a lot about project management in my current role.
So then you're suggesting project management over the project evaluation or project design.
Sorry, maybe I'm missing the question. I think I'm moving
Oh,
on.
so what the person was asking, how useful is
Oh,
it taking courses in project design, project management, and project evaluation?
I would, for my current role, if I had to choose out of those, I'd take project management. And then project evaluation, I don't know. I feel like I learned so much about about evaluating different things in my MPH, as part of my MPH degree.
Mm-hmm.
So I don't know that I would pick that one again, because I feel like I have that down, but definitely. And project design, maybe not so much either, because a lot of it is sort of preset.
Pre-designed.
Yeah.
Yeah. Okay. Okay, we've got some questions now. Stanley is in public health right now. He also got his green belt with experience in project management. What would you recommend highlighting on resumes and interviews when looking for roles using these skills?
I would like to know if you're talking about roles in industry, or if you're talking about roles like for public health.
Let's just go with, let's just say it's public health. I'm not sure which way Stanley was going with this.
And maybe it's both, if I
Yeah,
think
maybe
about
it's
it. So,
both.
okay, so here's something that I tell people that is not something I used to do with my resume. And you're the resume expert, Sarah, so feel free to correct me if you think I'm off base. But the one thing that I've learned in industry that I think really is something becoming more and more predominant in public health is looking at outcomes. So not something I learned in nursing necessarily, like measuring the things that, oh, thanks, Stanley, measuring the things that you've done. So industry for sure is very, very interested in what was the outcome of something you did. So when you're talking about managing a project, let's say you are saying, well, I managed public health clinics. Okay, so for a public health job, you might think, well, I'm just going to highlight the fact that I was the manager and that I had have people managing skills and all of that. If you're going to take that for industry, you really need to look at what was the outcome. So, and what was the end result? What were you going for? So it's more or less kind of like saying, well, I improved vaccine rates in my community by doing these things. And like, if you have by how much, that's even better. So they're really looking at what different projects did you manage or did you do, and what was the outcome.
Mm-hmm. I
So
totally agree. And I think that for the resume piece, it's always helpful to quantify what you're talking about, right?
yes,
And this is where I think a lot of nurses aren't sure. So I'll work on a resume with someone and I'll say, okay, you decreased fall rates, but by how much? And often they don't know. And like, if it's your project and you don't know, that is not, I mean, it's not ideal. It's not like something you may be able to dig back up. But if this is currently what you're working on, you should have these numbers, because how can you demonstrate your worth or what you've done if you don't have the numbers? Did you increase or decrease by 2% or 20%? Because that's a huge difference.
yes. And you
Yeah.
should also know national or provincial goals. So if you're able to compare, do you know what I'm saying?
Yeah.
If you don't even know the number and you say, that I assisted my organization in meeting the criteria for provincial falls reduction. I don't know, I just made that up. But like
Yeah.
it's like if you're able to say that by doing XYZ, which if you know that you did, but it's like it is a failing of the healthcare system overall to not set targets and have, it's not done in your daily work, so it seems kind of weird to keep track. But if you are doing that for your resume, you should know exactly how you made something better and by how much.
Absolutely. Here's another question. What are some of the different placements area for an MPH, for Masters of Public Health?
There's probably a long list now. So I did my master's of public health through the University of Waterloo, and I know that we had, like, there was a list you could choose from or you could find your own. So organizations were encouraged at that point in time to like kind of list MPH placements. I would say there's probably industry placements for it too. Like I know a lot of different industry partners will do like summer student type placements, or if you reached out to their HR, they might have different. I know you could get the schools involved in talking to different companies if you had a specific interest to set something up so that there could be MPH placements there. So I know some of my colleagues that did their MPH did hospital placements for masters in public health because they looked at bigger systems problems. I love systems issues. I like fixing issues, so that's where I instantly go to is where do you see something that's broken? And as an MPH student, you're in the perfect spot to say, how could we possibly maybe make that better? And I would look for places like that. So I'd say anywhere from government organizations, NGOs are a big place. They love MPH students because you get a project done that you might not otherwise have funding for. Public health units offer them as well.
Okay, that's great. I think that answers that question. And, I think that just in general, we talked about this before the call, but there's this concern from a lot of nurses that are leaving, I guess, bedside nursing for the first time that, I'm not going to be considered a real nurse anymore. I know you and I have both gotten this. And so I just wanted to share with everyone that there are many different ways to be a nurse. You don't necessarily have to touch a patient to still be a nurse, right? And like, I'm just going to ask this to you, Marlene, in your role in public health, but also your role right now in industry, do you feel like you're using your nursing skills still?
100%. it goes back to what I said about know what you bring to the table
Mhm.
and understand what your nursing skills really are. What are they at your core? What have you learned? What value add do you bring? And then where do your goals align to where you're going? But yeah, as far as nursing skills, I think I told Sarah this a little bit before too, but the first part of my move to industry, I truly understood how much some of my industry colleagues didn't understand about nursing and what it was like to offer in the vaccine space, to offer immunization clinics, to um, provide patient care, what it's like to counsel patients. A lot of the things that probably in some areas people would be like, oh, they wouldn't have thought of that as being like this really valued nursing skill. But now I'm able to actually help people walk them through it. So this is how it works. Absolutely. Use my nursing skills every day.
I think and just goes back to that saying, once a nurse, always a nurse. I've not met a single nurse, regardless of where they work now. I've talked to nurses that are even lawyers now, and not a single nurse has said they don't use their nursing skills daily. They're using them all the time. And so this is where I think, again, we need to be aware of the value that we bring. And we are using these skills that we learn daily. And, it's not even just in my professional life, it's in my personal life. Being a nurse has really been useful just to understand the healthcare system. And when a family member gets sick, just helping them understand what's happening, what they need to do. This is what you should go to emerge for. This is probably what you should go to your primary care provider for. So I think, there's so much to it that we just forget about. Honestly, we think this is just, common knowledge, but it's not. There is another question for you, Marlene. Top interview tips for an RN trying to break into competitive public health nurse roles, i.e., immunization and/or sexual health. So I don't know if you've participated in interviews or if you have any tips to add related to that.
That
Like like
yeah.
I guess for me, like I've helped some nurses get into public health roles for the first time, and what we really highlighted in certain cases was any interaction you had with public health. So if you are currently working in the hospital and you have interaction with public health nurses, like try to focus a little bit on that, or even just building relationships with external stakeholders, like any sort of groups that are outside of the hospital setting would be useful. In terms of interview tips, I guess it just depends on the role itself. Like you want to be familiar with the organization you're applying for and also generally what is expected of you in a certain role. And I think trying to make connections, like trying to show your transferable skills if you haven't worked outside of a hospital acute care setting before.
May I add something to that, Sarah, too?
Absolutely.
So one thing when I was interviewing or reviewing resumes for that was sometimes um, I found that a really good resume really actually helps you with a lot of so just make sure your resume is like really up to date and highlights the points that Sarah mentioned, because I think that since COVID, it's probably even more tricky because there's a lot of people that now have public health experience on their resume that didn't in the past. So Sarah's comment about the external organizations and the things aside from saying I work public health COVID vaccine clinics might make you stand out if that's, you know what I'm saying? That might, if that was your one and only foray into public health, continue to build those things around and get to know people. I think too, having your networking helps, and not giving up, because
Mhm.
those roles are really competitive, and sometimes it really is that 40 people with the same skill set applied for one job.
Yeah, it is really competitive. And exactly what you said, I've been contacted by a lot of nurses that had a contract with public health during COVID, and those roles kind of dried up. And now they had a taste of public health. They want to get back into it, but it is very challenging. And this is where, again, we keep saying networking, but I think there are different ways to network. So in this day and age, of course, you can network with people face to face, but there's also platforms like LinkedIn where you can expand your network. And it doesn't necessarily mean you're going to message someone and say, can you get me a job? It's more like get to know them, comment on their posts, ask them questions, just have a look at their profiles and see their career path. And maybe it's going to give you ideas about what you can do yourself. And get creative. It's not necessarily, there's not just one way to get a job. So it could be that you apply for a job, but on the side, you message someone at that organization and let them know you've applied and give them sort of an elevator pitch just to help yourself stand out a little bit. So lots of different ways. And I think that, if this is really your goal, like you said, don't give up, keep trying, apply to different jobs that maybe they don't have the word nurse in them, but they are still jobs that nurses can do nonetheless. And I posted this a while ago and I got a lot of engagement. And I think, if you really understand your value, then you'll know that there are jobs that are perfect for nurses. And just because they don't have the word nurse in it doesn't mean that we can't do the job. And Lynn, you are totally right. Nursing offers many transferable skills and knowledge. Absolutely. So if there are any other questions from anyone, please put them in the chat. Marlene, is there anything else you wanted to share? Anything you wanted to go back to? I think that you have had a really interesting career journey so far, and I'm really excited to see where you go next with this.
Yeah. I think I'm just going to reiterate what I said earlier is the be willing to take a chance. I think I wish that I had been a little braver in the past and saying, okay, maybe there, are other things to do, because I think there's really, if you're not growing, like if you're stagnant in your role and you're putting up with it, you need to be working in an area that brings you some kind of satisfaction every day. I think that is super important. And the older I get, the more I feel that way. Truly know what you have to offer, but also know what companies are looking for, and different organizations understand what it is that they want from you as well, and build that. If you need to take courses or skill sets, I think back to your comment about how to network with public health. There are a number of really great public health conferences in Ontario that you could attend in person and actually connect one-on-one, like personally with people as well, along with the web-based idea. Just be willing to start somewhere other than where you are if you want to land somewhere else.
Absolutely. I think the value of in-person conferences has really, after COVID, I think people really value that in person again. And just a really practical tip, I would say, if you're going to a conference, bring a business card. And you may think, I've never even thought about that. Or, I don't have a role that's worthy of a business card, but you absolutely do. And I personally, whenever I go to anything now, I bring physical business cards as well as one on my phone. And everyone's got a phone these days. You can scan and exchange information. So I would highly recommend that. Anybody can do that. And it is a really easy way to keep in touch with the people that you've met. I also personally, every time I get a business card, I add that person on LinkedIn. So that's a really easy way for me to keep in touch with them. If I lose that card for whatever reason, or I don't think of contacting this person again, then they're more or less on my radar. So, just these little things can help over time. And just know that if you have a goal in mind, just break it down into little steps so it's more manageable. So thank you so much, everyone, for listening. This is recorded, just so you know. It will be available on my YouTube channel. So if you go to YouTube and look up the RN Resume, this will be there. Thank you so much, everyone, for listening, and hope you got something out of this.